Good morning, I'm Mackie Shilstone, and joining me, as always, my son Spencer Shilstone, who's a corrective exercise specialist and also a performance enhancement specialist. And you wonder what we're doing on the good old kitchen table, and got a towel down right here. We're going to begin a four-part series on what we can do to help potentially reduce some back pain. And we're going to target the hip flexor muscle here. The hip flexor is right here on both sides, and it helps me to raise my leg. And if it gets tight, it pulls me forward. And the test we're going to do today is called the Thomas test. And Spencer, a lot of people use this test to assess the hip flexor.
Yeah, this is a test that's done by physical therapists, athletic trainers, orthopedic surgeons, even corrective exercise specialists.
Chiropractors. A whole list.
Yeah.
And so, again, this is a test that, as he says, healthcare professionals would do it. But we're going to show you right here. So I'm going to jump up on the table, and then you can do it. Okay?
So the one thing that you need to actually do this test is a table that's high enough and sturdy enough for you to sit on and let your feet dangle. So Mackie's going to get on his back, he's going to lean back, and we want to make sure that his knees are off hanging on the edge, okay? So first, why don't we lift up your right leg, and pull that back. Now you could see that he's got his leg all the way back, and then this leg right here is able to stay. He's well stretched in the hip flexor, so he has no issues in his hip flexor.
Let's show people what it looks like if they're not, okay?
Yep.
So here I am. I'm going to assume that I'm not stretched out.
Okay, bring it up. When he brings it up, this leg would rise with it. And that's because his hip flexor is too tight on the left side, preventing him from having it drop down like it should.
So we'll do the other test, and
Okay.
So I will come back because you have to check both
You
sides.
gotta check both sides. So I'm gonna get on the other side.
Okay.
Go ahead, lift it up, and look like he's been doing this for decades, so of course he's gonna be completely stretched out. But why don't we show it what it would look like if he wasn't? Lift up, bring up, and then there you go. We would know that his hip flexors are tight, and we gotta work on lengthening them as well as strengthening them.
Now, again, I can go back because we want to strengthen the hip flexor and lengthen it to be able to increase range of motion in also the hamstring. So if I were to go back, I could test myself with a straight leg raise where I would go back and I would... You want to get to that 90-degree angle minimum. So in other words, I'm going back there. But most people, I can't tell you the number of athletes that I've seen and everyday people that go back and they do the test and they're here. And then over here, they may be at this level. And again, it has so much to do with your own biomechanics. So Spencer, over the next 4 weeks, we're going to be lengthening. We're going to be dead bugs, marching, extending, everything, right?
We're going to be working on lengthening the hip flexor and strengthening it, and as well as strengthening it in a lengthened position.
All right, well, thank you very much. I passed the Thomas test.
He passed.
Next week, we'll be back and we'll show you over the next 3 weeks what to do. I'm Mackie Shilstone for Spencer. Stay strong.